Hello everyone, I'm Dr. Arun Swami. So in this video, we will discuss about the bone tumor. The bone tumor which is frequently asked MCQ in various examination, very important topic. So I will let you know how in a very crisp and in a shortest way, you can easily answer the questions from the bone tumor. So let's start. So first you should know the general description of the bone. Guys, you can differentiate between the adult and the children bone. तो सबसे पहले आपको ये पता होना चाहिए कि ये adult का एक्सरे है या children का एक्सरे है. तो there are such areas in the bone which is common in the children and in adult, but there is some difference between the adult and the children bones, right? So please pay attention first of all the common areas. Any top areas of the bone, this top area and this top area we call as epiphysis. Just after the epiphysis, this area we call as metaphysis, and the shaft area we call as diaphysis. Similarly, in the children, this is we called as epiphysis. Then this is your metaphysis, and this shaft area we called as diaphysis, right? तो या तो ट्यूमर किस में हो सकता है, either in the epiphysis zone, either in the metaphysis zone, or either in the diaphysis zone, right? So first of all, whenever you are differentiating the tumor, first you should always differentiate according to the area or the site of the origin, right? So either the tumor is arising in the epiphysis, either in metaphysis, or either in diaphysis. The difference between the children bone is that the children bones, they contain the physis which is also called as growth plate. So this growth plate is actually looks like a line on x-ray, and this line is actually looks like the empty line. और आपको देखने से लगेगा कि यहाँ पर ये बोन दो पार्ट में डिवाइड हो गई है. Actually this growth plate is made up of the cartilage, and cartilage never appear on the x-ray, and hence in the x-ray this area looks the gap area, right? So this is called as physis. So just please look at in the x-ray first of all the adult bone x-ray. Here you can see in this x-ray, there is no line present over here, isn't it, right? So there is no line present over here. It means this is the mature skeleton. And if this is the mature skeleton, guys, this is the adult skeleton. तो जब भी आपके सामने ट्यूमर के लिए या कोई भी एक्सरे अगर आएगा, फर्स्ट यू शुड आइडेंटिफाई वेदर दिस इज फॉर द एडल्ट एक्सरे और वेदर दिस इज फॉर द चिल्ड्रंस एक्सरे, राइट? सो हाउ यू कैन डिफरेंशिएट बाय द सीइंग द physis line, right? Physis line. So here no physis line means this is the mature skeleton and this is the adult skeleton part, right? Now in this picture you can see this area is actually the epiphysis. This area is your metaphysis, and downside area is your diaphysis, right? Diaphysis. Similarly over here in the children, you can see over here there is a clear gap line you can see over here, and this clear gap line, this is we called as physis. What we call this? Physis. And this physis is we called as growth plate. तो I hope आज से अगर आपके सामने कोई भी दो एक्सरे आ जाएंगे, you can easily differentiate कि कौन सा बच्चे का है और कौन सा बड़े का है, right? So if you are seeing any line over here like this, means this is the growth plate, this x-ray is for children, and if no line is there, means growth plate is fused, and this is for the adult x-ray, right? So let's begin the zone wise tumor distribution. So just now I told you कि either tumor can occur either in the epiphyseal area, either in metaphyseal area, or either in the diaphyseal area. तो आपको बस ये याद रखना है कि कौन से ट्यूमर हैं जो एपिफाइसिस में होते हैं, कौन से ट्यूमर मेटाफाइसिस में, और कौन से ट्यूमर डायाफाइसिस में होते हैं. तो जब भी आपके सामने क्वेश्चन आएगा, whenever you will get the MCQ in front of you guys, immediately differentiate where is lesion is actually mentioning in the MCQ, whether it is an epiphysis, metaphysis, or the diaphysis. So please remember this mnemonic. Any epiphysis tumor, just remember the mnemonic ECG. ECG, E stands for epiphysis, epiphyseal area, C stands for chondroblastoma, and G stands for giant cell tumor. Guys, please pay attention. Giant cell tumor is also called as osteoclastoma. And always remember, अगर कोई भी एपिफाइजियल का ट्यूमर आपको दे रखा है और इफ देयर इज द स्केलेटन गिवन फॉर द चिल्ड्रन, this is always chondroblastoma. So chondroblastoma is always in children, and giant cell tumor is always in adult. So any epiphyseal tumor, if history is given for children, chondroblastoma. If history given for the adult, giant cell tumor, right? How you can remember? You can remember like this. Blastoma means B for बच्चा और ये है child के अंदर, right? So this is the chondroblastoma in child. और adult कैसे होते हैं बेटा? Giant होते हैं, giant, बड़े सारे होते हैं, right? So giant cell tumor in adult. Okay. Now coming for the metaphyseal tumor, the mnemonic, remember MOSA, right? MOSA. So what is the MOSA? MOSA में M है metaphysis, O is osteosarcoma and O is osteochondroma. S is simple bone cyst and A is aneurysmal bone cyst, right? So mnemonic for epiphysis ECG, for metaphysis MOSA, right? And just talk about the diaphysis. Diaphysis का mnemonic है DOESA, right? That is DOESA. तो ECG, MOSA and DOESA, right? इसको आपको डोसा नहीं बोलना है, डोएसा बोलना है, राइट? थोड़ा सा इसको एक्सेंट को चेंज करके डोएसा, राइट? सो दिस डोएसा, D stands for diaphysis area, O stands for osteoid osteoma, ES stands for Ewing Sarcoma, and A stands for Adamantinoma, right? So this is how you can easily remember ECG, MOSA and DOSA, right? तो अब जैसे ही आपको लीजन आए, अगर वो कहता है epiphyseal area, you just need to remember ECG, C for chondroblastoma, G for giant cell tumor. बच्चे में है या बड़े में है, you can easily differentiate, right? So let's having some differentiation between these two condition. First, the chondroblastoma and giant cell tumor. So guys, here you can see in this X-ray, you can easily appreciate, guys, this is mature skeleton immature, mature immature, immature. Why immature? Because you can clearly see a line. This is your physis. Here again, this is the line physis. Immature skeleton means this is children. And guys, you can see over here, there is the clear cut X-ray is given over here. Something is there. And guys, this black area is present into the epiphysis area. And guys, in this epiphysis, children, just now I told you what is this? Chondroblastoma, right? Chondroblastoma. So this is your chondroblastoma. So remember, chondroblastoma is always in the children, most common in epiphyseal area, in proximal humerus, proximal femur and proximal tibia. And remember, the one appearance for this chondroblastoma is chicken wire calcification, right? Chicken wire calcification. Okay. Now, giant cell tumor always in the adult, in epiphysis of distal femur proximal tibia, and special appearance over here, soap bubble appearance, right? Soap bubble appearance. Okay. So this soap bubble appearance, again you can see in this X-ray, you can clearly see over here, no line is seen over here. So no line is seen over here means this is the mature skeleton. And guys, you can see over here, this completely epiphysis is swelled up like this. And this is actually starting from the epiphysis and going up to the metaphysis area. And this is originated from the epiphysis, we called as GCT, right guys? GCT. So this is giant cell tumor, right? Number next is ABC or SBC. ABC means aneurysmal bone cyst, SBC means simple bone cyst. Guys, दोनों ही कहाँ होएगी? Metaphysis area पे, right? MOSA. Remember MOSA? MOSA, right? Simple bone cyst, aneurysmal bone cyst. So this is, both are in metaphysis zone. And guys, please pay attention. ABC के अंदर ब्लड की भरी हुई सिस्ट होती हैं, जो छोटी छोटी पॉकेट्स होती हैं, थैलियां होती हैं मल्टीपल, and they are filled with the blood. And in SBC, there is only a single pocket, and this is fluid filled pocket, right? Fluid filled pocket. So this is called as ABC and SBC. Always please remember, ABC can also show the soap bubble appearance. लेकिन अगर soap bubble appearance epiphysis में है, GCT. अगर soap bubble appearance ABC के अंदर है, soap bubble appearance अगर metaphysis के अंदर है, तो this is your ABC, right? And the special appearance seen in SBC is fallen fragment sign, fallen leaf sign, right? Fallen leaf sign. And guys, always remember that there is the site. ABC is always in distal femur and in proximal tibia, and SBC in proximal femur and the proximal humerus. And always this SBC can show the pathological fracture condition, right? Pathological fracture condition. And this you can see over here, this is the fracture line, you can clearly see over here. So this is the pathological fracture is seeing over here. So this is how you can easily differentiate. Again, you can see this is growth plate is clearly visible, means this is the children X-ray, right? Here again you can see the growth plate is clearly visible. Again, this is the children's X-ray, right? So this is how, if fallen fragment sign is given, always answer SBC. If your soap bubble appearance in metaphyseal, always answer ABC, right? ABC. Now, the next part is osteochondroma and osteosarcoma. Guys, osteochondroma and osteosarcoma, you can differentiate like this. Osteochondroma, there is always pedunculated extra overgrowth at metaphyseal area. Again, this is the part of mosa. वापस ये भी mosa से ही है, right? So this is osteochondroma and osteosarcoma, right? So there is extra overgrowth, we called as, this is chondroma, right? और अगर आपको यहाँ पे सन रेज और सन बस्ट अपीयरेंस दिख रहा है, guys, this is your osteosarcoma, right? Osteosarcoma. So always remember these classic features of the osteochondroma. What are the classic feature? This is the benign condition. This is that painless swelling and mainly present into the distal femur, and there is the flattened cauliflower-like appearance, right? In osteosarcoma, there is a progressive pain. Always remember progressive pain. अगर वो बोलता है progressive pain है, this is goes for the osteosarcoma. And just see over here, guys, this is the condition. No growth plate is visible over here. This is the mature skeleton, and you can clearly see over here. This is your sun ray or sunburst appearance. So this is osteosarcoma. Then the osteoid osteoma and Ewing sarcoma. This is from DOESA, right? DOESA, right? DOESA. ECG, MOSA and DOESA, right? So this is Ewing sarcoma and this is osteoid osteoma, right? So please pay attention. Both are in the diaphyseal area, but osteoid osteoma is the benign condition and Ewing sarcoma is malignant. Please attention, guys. There is only one tumor which is giving the night pain condition, and guys, this night pain condition tumor is osteoid osteoma, right? And this night pain is always relieved by the NSAID. तो वो आपको देगा कि there is a night pain and which is relieved by the aspirin or the NSAID or anything. This is suggestive of osteoid osteoma, and there is nidus is present. Nidus is present. So you can see over here, this is your nidus, right? So this is the diaphyseal area, and you can clearly see this nidus over here. So this nidus, if less than 2 centimeter, this is osteoid osteoma. If nidus more than 2 centimeter, this we called as osteoblastoma. What we call this? Osteoblastoma. Okay, so this is only the difference between osteoid osteoma and osteoid blastoma. If nidus less than 2 centimeter, osteoid osteoma. If more than 2, osteoblastoma, right? So there are some different condition. And in Ewing sarcoma, guys, please pay attention. Special appearance, onion skin appearance, right? Onion skin reaction, that is the periosteal reaction. You can see over here, this is the onion skin reaction or onion skin appearance. Okay, so this is the difference between osteoid osteoma and Ewing sarcoma. Now the adamantioma. Adamantioma के लिए आपको याद रखना है, this can also show you the soap bubble appearance, but this is going to be happen in the diaphyseal area. And also remember, there is cytokeratin positive condition. This is cytokeratin positive condition and mainly happens in the tibia area, right? In the tibial region. And this is again in the young age group, 20 to 40 years, right? Now, the chondrosarcoma is the second most common primary malignant bone tumor, and you will see over here the popcorn calcification or ring and arc calcification. So investigation of choice, that is your MRI, right? MRI. तो अगर आपको कुछ ऐसा सा दिखे, this is again in the metaphyseal area. This is like the popcorns over here, and this popcorn is actually chondrosarcoma, right? Chondrosarcoma. So the MCQ is, a 16-year-old boy present with severe pain around the knee for 3 months. X-ray shows a metaphyseal mixed lytic sclerotic lesion with sunburst and the Codman's triangle. CT chest is advised before surgery. The diagnosis is Ewing sarcoma, osteosarcoma, chondrosarcoma, osteoid osteoma. So guys, first you should identify in which region. This is the metaphyseal area. In metaphysis, we know there is MOSA, right? MOSA. So this is your, and also there is given sunburst appearance and the Codman's triangle. So you can clearly see this MOSA. O stands for osteosarcoma and osteochondroma. So osteochondroma is not given in the option there is osteosarcoma is given, and we know in osteosarcoma there is sunburst and the Codman's triangle is seen. So the right answer of this MCQ is osteosarcoma, right? Osteosarcoma. The second MCQ, a 13-year-old boy present with the fever, pain, swelling and elevated ESR. X-ray shows a diaphyseal lesion. So here it is lesion in the diaphysis area. Lesion in diaphysis area. And in diaphysis area, there is shown onion skin periosteal reaction. Most likely diagnosis is. So guys, we know that diaphysis mnemonic is DOESA, right? DOESA. And in this DOESA stands for Ewing Sarcoma, Adamantinoma, and this is your Osteoid Osteoma, right? So we know onion skin appearance is seen in Ewing Sarcoma. So the right answer of this MCQ is Ewing Sarcoma, right? Ewing Sarcoma. Now, the next is a 24-year-old woman has knee pain. X-ray demonstrate an eccentric epiphyseal lytic lesion. So where is the lesion? In epiphyseal area with soap bubble appearance in the distal femur. Guys, in epiphysis, we know the mnemonic is ECG. So if there is an adult condition, this is giant cell tumor, and if this is the children, this is Chondroblastoma, right? So this is age is given 24-year-old. In epiphyseal area, this is your giant cell tumor, right? Giant cell tumor. So you can see over here that if you know only the location, you can easily answer such tumor question, right? With this mnemonic. And the last question, a 15-year-old boy has an incidental painless bony swelling around the knee. X-ray shows a pedunculated metaphyseal bony projection with continuity of the cortex and medullary canal. So guys, where is the lesion? Lesion is clearly given in metaphyseal area, and this is pedunculated, means this is originating something like this. This is the bone and originating from the bone like this, guys. This is your, we know very well that this is your osteochondroma. This is your osteochondroma, right? So the right answer of this option A, osteochondroma. So I hope with this method, if you know the area, in which area there is a tumor, either in the epiphysis, in metaphysis or in diaphysis, you can easily differentiate all of this tumor. And also you should know whether their physeal line is seen or not. तो अगर आपको physeal line दिख रही है, X-ray for children, no physis is seen, then this is X-ray for the adult. So I hope all you are going to always correct this MCQ from the bone tumor if they are asking in the various examination. So all the best to all of you guys. Thank you very much.